Okay. Welcome to the Illinois Academy of Criminology's 2024 inaugural webinar. This webinar is on the topic of crises, plural, and corrections, recruitment, retention, and well-being of correctional staff. I'm Jona Goldschmidt. I'm the president of the Illinois Academy of Criminology. I want to welcome our panelists, Betty Gondles, Kelly Firebaugh, Eddie Caumiat, who will be introduced formally by our moderator, Elvis Slaughter. I want to also introduce Sophia Rana, who's our IT expert and webinar coordinator. So the Illinois Academy of Criminology, for those that don't know, is a nonprofit, nonpartisan organization. We've been in existence since the 1950s, and we've been putting on educational programs on contemporary cutting-edge issues in criminal justice generally. We have a set of members who are all practitioners, scholars in the fields of in the three fields of criminal justice: law enforcement, courts, and corrections. We welcome anyone who would like to apply to be a member of our academy by going to our website, which is illacad.org. That's ILLACAD.org. There you can apply, you can submit a membership application. I now want to introduce our moderator, Elvis Slaughter. Elvis is the former president of our academy, and he's also a former fire and police commissioner. Most importantly for this program is he's a retired sheriff's superintendent of corrections at the Cook County Jail in Chicago, and he's had more than 30 years experience in criminal justice and law enforcement and corrections. He's the author of 11 books, including one called Safer Jail and Prison Matters, that has a chapter on recruitment and retention of correctional staff. And he's also the author of numerous published articles on criminal justice issues. Elvis has made presentations on correctional issues at conferences of the National Gang Crime Research Center, the Tennessee Correctional Institute, the American Jail Association, and the Illinois Correctional Association. He's currently our vice president. He's a criminologist and a consultant and an educator. So thank you, Elvis, and I'm going to turn the program over to you.
Thank you, John. I really appreciate the introduction. Once again, Crisis Corrections is the title of this webinar, and we have three exceptional, outstanding speakers that will enhance our knowledge concerning crisis and corrections. We will cover three areas: recruitment, retention, and staff well-being. At this time, I would like to tell you a little bit about our speakers. First speaker is Dr. Betty Gondles. She is the president of Sinon Incorporation, a correctional consulting firm. She has served the correctional field for over 38 years. She has worked extensively for the American Correctional Association as a senior director, overseeing the Office of Correctional Health, Professional Development, activities for domestic and international government agencies and private sector. Dr. Gondles has received many awards, including being the recipient of the ER-CAS Correctional Achievement Award, the highest award given by Corrections from ACA. Additionally, she received the Walter Dunbar Award for her contribution on national and international performance-based standards and expected practice in American and international corrections. She's also the co-author of an article by ACA titled Staff Recruitment and Retention. And this article was widely published, and it encouraged us to produce this webinar. Our next speaker is Eddie Caumiat. He's the Regional Director with AFME, Council 31. Acknowledged as Chief Statewide Safety Officer and liaison for AFME, Council 31, to the Illinois Department of Corrections, Juvenile Justice, and Parole for the last 15 years. As we all know, being a union boss is one of the most demanding jobs in correction and in the country. Our third speaker is Kelly Firebaugh. He grew up in Southern Illinois, where he graduated from Centralia High School before joining the U.S. Navy. His first 8 years in the military were as an electronic technician. He served as the public affairs leading petty officer for the aircraft carrier USS Nimitz, and also a public affairs officer for the Navy Recruitment District in St. Louis. In 2019, he left the education field and joined the state of Illinois workforce, first as a social service caseworker for a short period before joining the Department of Children and Family Service as a human resource representative and recruiter for Southern Illinois, Central Illinois, and the surrounding states. And in 2023, he left DCFS to become the recruitment coordinator for Region 3, which covers Northern Illinois and the Chicago area for the Illinois Department of Corrections. These are our three outstanding speakers. Would anyone like to make an opening statement?
I would be more than delighted to.
Thank you.
Okay. First and foremost, good morning to all, and greetings. First and foremost, I want to thank Jona Goldschmidt for inviting me to participate in this webinar on one of the most important challenges we face in corrections, which is recruitment and retention and well-being of our correctional officers and correctional staff across the United States. When I was a senior director of the Office of Correctional Health for the American Correctional Association, the ACA was awarded in 2019 a cooperative agreement by the Bureau of Justice Assistance on correctional staff wellness. And as a part of that cooperative agreement, we included researching why there is a high rate of shortages of correctional staff in our jails and prisons. So we did a national scan of correctional agencies across the country, followed by in the field work, workshops and presenting at national conferences and webinars. We published several articles, and one of those articles we did was based on that national scan and on-site field work we conducted in the jails and prisons across the country. The article that was published by Corrections Today in January and February in 2023, and as mentioned before, that title is Staff Recruitment and Retention in Corrections, the Challenges and the Way Forward. One thing that we all know is employees are the most valuable assets in corrections. I believe there is a widespread agreement that staff are essential to any corrections agency's overall mission and purpose. We in corrections must rely on well-trained, experienced, and devoted workforce to provide security to our facilities, communities, and stay on track with the larger mission of public safety. Several academic papers that found that the three most examined outcomes addressing corrections personnel, of course, is pretty obvious: the job stress, job satisfaction, and staff commitment. As a result, the challenges faced by correctional administrators are: one, concerned over high vacancy rates, and two, large turnover rates of correctional officers and correctional staff over the last few years. And I would like to note that this is a critical challenge started way before COVID. This is one thing we can't blame on COVID. Corrections and leaders have made recruitment and retention a critical priority. So we in corrections cannot find enough correctional officers as well as other correctional staff to support our programs, not just correctional officers for the security piece of it, but the health services and our inmate programs and other services that we must give in corrections. In 2018, the CNA Center for Justice Research Innovation published a report addressing this critical problem of recruitment and retention of correctional officers. The correctional profession was characterized in this report as a state of crisis due to the struggles of recruitment and retention. So when you review the literature, which I did over the last several years, which goes back to about 2016, I reviewed from about 1985 to about 2017, and it revealed common things which have contributed to the all-time lows in staffing, to include the stress, stigma, high staff turnover, low morale, high injury rates, and the psychological duress. There was a survey also conducted by the Correctional Leaders Association, which represents the 50 state departments of corrections, the 4 largest jail systems, U.S. territories, and military corrective systems. Recruitment and retention consistently tops the list as a priority for correctional administrators. And some of the data that came out of that survey was, for almost 50% of correctional agencies, officer turnover rates range from 20 to 30% annually, and 38% staff leave within 1 year, and about 48% of staff leave within 1 to 5 years. As we look at additional recruitment challenges, and the stigma of corrections, we compete with the local businesses in rural outlying areas, and they offer more competitive salaries, and let's be realistic, a favorable, better work environment and schedules, and that health and wellness related factors are a main concern that keeps qualified and experienced employees away from the field of corrections. And we could talk, and I hope it comes up, some of the recruitment strategies that we are looking at, like sign-up bonuses and relocation expenses, and better training programs. And of course, we'll have that discussion on staff wellness and doing a better job with marketing. But those recruitment struggles continue with negative perceptions of corrections. And as a career choice, several states have even lowered the age of requirements to 18 to attract new staff. And some of our key challenges that we have in retention, once again, is a lot of it that we have with recruitment, that once we hire them, they see that the stresses of the job, the occupational danger, and of course, the differences in millennials and Generation Z or Zoomers are not incentivized by a lengthy career like the field of corrections, and are not satisfied, and that crowding issue. So we see a lot of that with staff burnout and not very good retirement systems. So we look at that, and just a recent survey that was published this year, it continues. In Corrections Today in January, February 2024, the ACA Research Council did a survey, and the top reasons, once again, were that work-life balance issue, the pay, shift and flexibility, work environment, and retirement benefits. So we ask ourselves, what is the impact on corrections? What is the cost? Not just the economic cost, but the human factor cost of staff shortages in correctional systems. These costs are on 2 major fronts and have quickly added up over the years. It will require our local, state, and federal governments a substantial investment in time and money, but the most important impact has become detrimental impact on corrections staff, public safety, and inmate rehabilitation. With those comments, I would like to turn it now back to our moderator, Elvis. Thank you very much.
Betty, thank you very much for that very informative opening statement. Is there anyone else who would like to give an opening statement?
Eddie Caumiat, Regional Director with AFSCME Council 31. Appreciate the opportunity to be part of this webinar today and to be here with so many colleagues that touch so many parts of this work. I have been the regional director for the Southern Illinois region since 2009, so I've served in that capacity for about 15 years. And, you know, a lot of our prisons in Illinois happen to be in outlying and or rural areas. My region is no different than that. So as part of my job duties with the union, I've been designated as the liaison for corrections between the union and corrections for that tenure. So about 15 years, I've had the privilege of serving the women and men who serve the state of Illinois in this capacity. And yeah, I've seen the industry really, you know, change over that period of time, and some to the good. When I started my tenure, we were at about 149% capacity of the system per ACA and every other regulatory body that I'm aware of. We were stacking offenders in those facilities, in some cases in gyms on the floor. It was a very difficult environment because of that overcrowding and because of, you know, the tensions that that kind of situation creates for everybody involved. And over time, you know, thankfully, we've seen that inmate population come down to a more reasonable size. In fact, currently we're looking at a prison system that's about adequately sized, and I'll get into the whys of that in just a second. But you know, they are appropriately utilizing the resources on the ground. They do seem to have, you know, close to enough space for offenders in the system, except for, and it's a notable exception, the damage that was done to the system with the closure of TAMS, the Supermax facility in far southern Illinois, which put a lot of pressure on the system in the way of maximum security inmates, or very difficult, incorrigible offenders who the state continues to struggle to deal with in an adequate way. So we've been dealing with sort of that pressure of inadequate facilities for the type of offenders that exist. You know, since I began and probably well into my retirement and beyond, it's a very difficult industry in that way to deal with human nature. You know, when it expresses itself as negatively as some offenders can. So, in addition to sort of that situation changing, you know, going from overcrowding to a little bit more reasonable situation inside the facilities, we've seen, and Betty points to, a real challenge in getting and keeping staff engaged. And it's for a whole host of reasons, and we've touched on some of them. And I think that's a very, very good and cogent list and explanation as to why some of the things that we're seeing are occurring. You know, fundamentally, when Tier 2 changed, it really changed the industry in Illinois. And by Tier 2, I mean the pension system that's already been referred to by Betty. Rather than being able to earn a retirement over a reasonable period of time, starting as a young person and getting into your sort of well, what I hope is you're still young, but seasoned adulthood. You know, it used to be you could contemplate, I'm going to give the state 30 years, and at the end of it, I'm going to have a reasonably, you know, comfortable retirement. That has changed for every person that's coming in the doors these days, and they're looking, you know, kind of staring down the barrel of a career that could last as long as 67. You know, which, you know, as I'm in my mid 50s and thinking about running after an inmate, I can only imagine trying to do that in another decade. So there's sort of this barrier there, just in contemplation for people. They can't really see themselves doing this work long term. In many cases, I think we're seeing, you know, that challenge continue. Elvis, you mentioned, you know, being a union official is a challenging job. That's true. But also, you know, our union AFSCME has done a pretty good job by this sector and by this industry. And, you know, the pay that our women and men receive, we're quite proud of. It still is a challenge for that entry level salary. We've seen the state of Illinois in other times increase that entry level salary commensurate with whatever other industries are doing to attract more candidates. And for whatever reason, that doesn't seem to be their approach in this current moment. Some of those salaries, you know, for law enforcement officials, I'm sure feel either artificially low or just not enough to do the work that they're seeing in front of them. And you know, kind of one of the final things I want to talk about, because I think it's a specter that hasn't been mentioned that really does impact many of these areas, is the physical state of the prisons in Illinois, in particular. Our members do a great job at you know, kind of keeping what they have operating and moving forward, and you know, being able to utilize those resources as effectively as possible. But the simple fact remains, and I think there was a study a couple of years ago commissioned by both the Department of Corrections and the state of Illinois that shows about their figure is around $2 billion of deferred maintenance that has happened over time. And when we see the impacts of that, I would say the most current impact is clearly the state's contemplation of a wholesale closure of Stateville, which has been a, you know, kind of a linchpin of the system for a long, long time, and a place where they did a lot of good reform and rehabilitative work over the last decade. You know, the situation there, according to the state, is bad enough that they have to contemplate, you know, fully closing that facility. One of the most diverse facilities that they have in the state of Illinois. One of the most important, really, for the offender population in the Chicago area. You know, they kind of let it languish so long that they're actually contemplating about closing that. And it's not the only one. It's just the most recent example of you know, sort of this casting about for solutions in a system that doesn't seem to always be able to provide a clear vision for you know, for what the system should be here in Illinois. So I think there are a number of challenges, and I hope we dig into them today in a way that not just, you know, helps our audience understand corrections, but really helps corrections find some new paths and some new footing forward. I think there's some very simple solutions, you know, for staff retention, for you know, for trying to increase the morale and you know, the sense of sort of purpose that that folks in corrections have historically held and continue to have even in the face of all these challenges. So I look forward to the discussion. And with that, I'll pass to my colleague.
I'm Kelly Firebaugh. Like I said, I'm originally from Centralia, Illinois, so I grew up with in a prison town. We have a very large facility there. It was built when I was a child, and I knew many, many people there. I'm probably the only person on here, though, who does not have a long history with corrections. However, I do have a long history with public affairs and recruiting, serving as a public affairs officer for a 6-state region of recruiting. I've been recruiting for the state itself with DCFS for many years. And this past year, corrections brought me on to help build up their recruiting program, because they really didn't have much of a recruiting program before. They had one person as a coordinator for the entire state. So they split that up. There were 3 different regions. So we have a little more. We're working more with getting our people out there, trying to reach out more. And as Eddie said, we have the best people in the world working for us already. I haven't met anybody out there who is not dedicated to what they want to do, but we need to spread my job more is to actually go out there and spread the word of what we can do and the positives. You hear too much of the negatives constantly about corrections. People don't hear the positives, and they don't know the positives. And like you said, we probably have the best pay. I know we have the best pay of any state around us, and one of the best, some of the best benefits of anywhere around in the country. But people just don't realize that kind of stuff here in the state of Illinois because of the misperceptions and the miscommunications we have out there. So that's really just my focus. Like I said, they took me and they assigned me to the northern region because that is where the population is. So I cover all of northern Illinois from Galesburg through Peoria to Kankakee and all the Chicagoland area. So I get the wonderful work of trying to spread the word of what we can do and how we can help people out in that area. And I'll just pass it back along to you then.
Thank you all for the very informative opening statement. Most of the questions under recruitment were covered from your opening statement, but I do have 3 questions, and this might be for Kelly or anyone who would like to answer it. The first one is, what role does technology play in modernizing recruitment processes for correctional staff and what improvements can be made?
Oh, for modernizing, I said the state finally did just go to about 2 years ago. They went to an online application system, which is working better for us. It's trying to get things done quicker. But the state, I will say, and everybody knows this, even the people at Central Management Services know this, it's a slow process, and they're slowly trying to get this built up. But a lot of that is because they're keeping politics out of it. We don't want to have, my friend said this, my buddies come into here. So the state is slowly trying to build up a very, very slow process for getting people in. I won't make excuses for them because I do not work for Central Management Services, but it's a problem that we all know we have, and we're all trying to face it. As far as corrections, all of our non-security jobs have to go through that process. So it takes a long time to get in that way. The security officers actually have a shorter process. So we're probably one of the quickest ways into the state, but it can still take a long time. But we have gone to a system where we are bringing people to apply online now. We do need to reach out. We're looking at more ways to go in with YouTube ads and Instagram and all these other little things. And I said these are things we're looking at. But once again, when you're working with the government, it's state. I was a teacher before. Before that, I worked with the federal government a year. So anytime you're working with the state, it takes a long time to get people up at the top to realize that the people, the 18, 19, 20-year-olds they're looking for are not the 50-year-olds who are running everything. And I think it's a problem we see across, but hopefully we're trying to get that. We're trying to bring more new blood in and try to change that, get people in there who actually understand what's going on. And I'll pass it along to my colleagues as they might have more answers on that.
The recruiters in Illinois do an amazing job with what they have, and I just want to give credit where it's due. It's a very difficult, I think, prospect that they face, and they face it quite well. We participate, the union does, in hiring fairs across the state of Illinois. Once we've sort of seen the benefits of the kind of getting the word out electronically and doing those things, I would say my addition to this part of the topic is some of the things that have been lost in applying technological solutions are really that personal touch. Talking to new recruits from a place of experience rather than them sort of reading or thinking about an industry that they've never really thought about before in some cases. Really having access to people who are in the work and who have a good outlook of the work, I think, is a critical component that certainly from our vantage in the union, we've been trying to restore. Historically, there was a list of paper list that would be held by the facility of prospects. And when they were getting ready to hire, the facility itself would call those prospects. And sometimes it was people they went to high school with, or people they went to college with, or people they know from the community. There was sort of a real, sort of building them into the fabric of both the community and the facility in that way. And, technology is very important. We can't escape it. It is a critical component of our modern world, but there's a human touch that got lost there. And I think that when we really apply ourselves in sort of going out there and pressing the flesh and being part of the discussion with these candidates, we see those numbers come up quite a bit. We've had some good pilot programs in places like Lawrence, places like Menard. These are communities that are not necessarily easy to get younger prospects to think about going to, and we've seen almost 100% uptake of the job from the current hiring lists when we go that extra mile and apply the human touch. So I would say that's a critical component, no matter how much technology we throw at it.
One of the other things that I'd like to add to this is the multi-generational workforce and how we market to 5 different generations. And I think some of the things that we're seeing across the country is the way you address a Zoomer is different the way than you address a millennial or even a Generation X. What attracts them? How do you communicate to them? So I think we have to look at how we market to those, where you look at your Instagram and you look at more of a technology wise how you communicate, because that's what our Zoomers want, a Generation X or a millennial. And we're hiring older people. They're not all young people across the country that we're trying to hire. I've seen in some areas, in some of rural areas, is where you go through the downtown and you see on a corner a bus with be part of the boldest, that written communication. So I think we have to look at, and human resources has to look at, how we communicate to recruit people and dispel the myth about working in corrections.
I want to point out to one thing she kind of touched on there was not just generational, but locational. Reaching a person in Chicago or the Chicago suburbs or Aurora or Joliet is completely different than talking to a person in Vienna or Menard or Chester or even Springfield. And a lot of times they don't realize that. Like I said, I'm lucky and unlucky. The same reason my region covers Chicago to Galesburg. Two completely and utterly different types of people you're going to talk to when you go to each one. And that's something we always have to look at too when you're reaching out and letting people know. Like I said, we do pay, but unluckily we don't have. And I think Eddie hit this. Most of our facilities are in rural areas because that's where. But most of our population is in urban areas, and letting people know that there are capabilities outside of those urban areas is a big draw.
And this conversation brings up another place that we've been trying to influence this hiring piece, and that is, historically there are academies that we send cadets to. They're sort of one central location in any given area. This is true for the Federal Bureau of Prisons. It's true for corrections in Illinois. That academy exists. It used to be in Springfield. Now it's in Decatur. There are a couple problems with the academy model, in our opinion. One is that the new academy, while it's lovely and has great resources and technological VR, like cell blocks where you can really sort of dig in and teach the work, it can only graduate about 90 people every 6 to 8 weeks. Our deficit in Illinois requires hiring at about double that clip in order just to keep up with attrition. So part of the last round of collective bargaining for the state of Illinois, we really zeroed in on hiring, and a number of agencies, and corrections is one of them. We have a hiring committee, convenes on a regular basis, and that committee is working on a model where we can regionalize that training, where we can take training where the need is versus forcing candidates to go to an academy that might be, hours away from their home. The idea is they can still be trained. We can train them effectively on the ground, in a facility in a given geographical location, but it won't totally disrupt their life for 2 months while we're trying to graduate them. And we believe that's a model that, has some legs and is really worth, applying. We've seen it work in targeted places before, like Murfreesboro, Pontiac, where they've had need. Of a large number of people in one fell swoop. We've seen that work before. So we want to try some more of that as well.
Eddie, that's a good point. Some of the things that I'm seeing nationally is that we're seeing a combination of doing e-learning with on-site training. That's where technology has helped us in that area. Where they have the basics first through an electronic platform from our academies with the same instructors, and then they do on-site training, a shorter period of time, whether it's regionally or in a central location in a state. And then not only that, when they get assigned to a facility, they have a senior officer that is their buddy, and that's who they assigned with. And there's cross training, and that's another area of upward mobility when you have a senior officer that becomes a trainer on site for promotional reasons. So not just e-learning, shorter in the academy, but also that on-site experience with a senior officer that has gone through how to deal with a new recruit and has been trained on that.
Right. And before we go to retention, I do have one more question. And I think, Betty, you touched on a little bit. How effective our current recruitment campaign in addressing and dispelling the myth and misconception about the corrections profession?
Oh, that's probably one of our biggest problems out there. And one thing I do, and my other fellow coordinators do, is what we do in Illinois, at least, is we have trained recruiters at each of our facilities. So if I was going to be going to Loyola for an actual job fair, I wouldn't necessarily go myself. I would get a hold of somebody, one of my parole officers in the region, or somebody in Aurora, and actually have somebody from the field who works in this and has been trained to go out and as a recruiter and go out and talk to these people. So when they go to the table and shake their hand, they actually have somebody who's done the job, or is doing the job, and knows better than anybody else. So we have that. We have, like I said, most of our events are now covered by field recruiters. They go out there, and it's a great way for them to reach out to the people to let them know our parole officers, our corrections officers, or our counselors are real people. They are not what you see on TV. They're not Orange is the New Black. They're not Prison Break. It is. When I'm out there, I tell them all the time that what you see on TV is what you see on TV. That is not reality.
Exactly.
There's no way in the world related to what the real world is a lot different. The other big conception we have, especially in the Chicago area, and Eddie, Elvis probably knows this very well, confusing state corrections with county corrections, which
Oh,
are
yeah.
completely and utterly different things altogether. But especially in Cook County, you get your corrections, you think Cook County corrections. And I said, no, that is not, we get them on, we're trying to explain that we get them on the end where we're now helping them get out of the system. Where
Right.
our job is to get them in. Our job, I tell people, our job is to not see you again. Our job is to get you through here and not see you again. We're not here to punish you. We're here to help you. And we're here to help people get moved along. And people don't realize that. They still think it's Shawshank. You're here, bang the door, lock it away, and see you in 3 years when it's time for you to leave. And I use Kiwani as one of my great examples all the time of what we do with corrections now, where it's all about rehabilitation, where it's about getting people out, and I said getting them on a right path for their life, so they don't come back to see us. We don't want to see you again. I said not to be bad, but we don't want to see you anymore when you walk out of our doors.
Right. And as we pivot towards retention, employee retention and turnover rates are a serious and a major challenge for correction agency. The first question is, what are the primary factors contributing to high turnover rates among correctional officers in the United States?
Wow. We kind of touched a little bit on that, and I think is the stress on job. If you look at keeping them, and you look at the data, and the data says in the first year how many leave us. We get them through the door, we get them initially trained, and then what happens? They get on the job, and they leave us. And I think it's they find out that, well, maybe it wasn't quite what they thought it was going to be. So I think some of the recruitment, the retention is that we have to address things on the work-life balance. That mandatory overtime is one of the things why we lose them. I think we see our correctional officers getting burnout, and divorce rates, and developing chronic disease like hypertension because of the psychological impact of working in a high stress environment. So I think those are some of the major things, and the stress of having occupational danger, and not having time to do other things. Not so much for the older correctional officer, which is a little different attitude towards longevity at a job and stuff. But again, that younger generation, that younger workforce, for their time and their personal time mean a lot. And when you make them work that mandatory overtime, they have no time for one of the pillars of staff wellness, which is that social aspect. it puts a lot of stress on that, and they don't feel fulfilled. And I think Eddie talked a little bit about that crowding factor. You know, they're going into these facilities, particularly the younger generation, and the challenges of coping. So I think we have to do a better job in training and preparing and developing wellness programs for our staff. And I think that that's a key to keeping staff. You know, an agency that cares. An agency has to care about their biggest asset, which is their staff.
In the article that you all published, they have some very excellent points about how to retain. And the question is what best practices from other states or industry could be adopted to enhance retention rates among correctional staff? I remember reading your article, and y'all had some excellent points in there. Can you talk about a couple of those points?
I think some of the things that we have to work on for retention of staff is to address these areas that we're finding issues with in exit interviews and why people are leaving us. And one, again, is that personal time. They don't want to, schedule flexibility. So some of those things, kind of like what I just said before, we got to do a better job from an agency perspective in addressing the reasons why. Now, I think there's some states that do a better job. Other states that don't do another job. Some local corrections, for example, one that just stands out to me is Davidson County, Nashville, Tennessee. They have an excellent staff wellness program. They have places for their staff to go and work out. They, nutritional counseling, some of the things to do. We got to take care of our people. And I think that this is some of the things that we haven't, generally speaking, over the years have done a good job with. You've got some states, and I think Illinois has an excellent staff wellness program. I know when your director Jeffries was there, he was very much promoting some of the programs to your correctional staff there. Also, when Colette Peters, who was the director at the time, now she's the director of the Federal Bureau of Prisons, that was out in Oregon, they were all in with staff wellness, really looking at those pillars to help keep the staff there, to address the issues. And some of the other things, and I just want to reinforce the environment that they work in. And Eddie mentioned that, these older facilities, some of the things that we have to do. Who wants to get up and go to work at a dirty facility every day, and that there's not enough staff to cover the shifts that day, and you're out there, and that's not a good environment. That doesn't do good to the psyche,
And I want to say, that on you, we have Director Hughes now. She's still following on. In fact, this past spring, they expanded the staff wellness. We are now the first state to extend staff wellness seminars to family members, to adult family members.
Wonderful.
So it's not just, every one of our facilities has a staff wellness room. They have staff wellness trained people, and they will go to other facilities. So you don't have to talk to somebody from your own facility if something happens. They'll have somebody come from a different facility to come talk to you. So, if there's something you don't want to discuss with, just for your own personal reason, you want to discuss with somebody you work with, say you're at Menard, they can get somebody come in from Pinckneyville, or somebody to come in from Big Muddy or somewhere else to there's still a trained person, but somebody you can talk to. But I was going to say the one thing you said, that and the retention, that leads to the recruiting too. And it's a vicious cycle. When the retention isn't there, people are disappointed. People are disappointed in town. They talk. That leads back, which makes it hard for recruiting again. And it's a terrible cycle. Once the reputation gets out, it can't. A bad reputation can't be put back.
It's absolutely true. They have a staff wellness program. It's founded on a number of different ideas and principles that I think are very valuable to people who want to participate. There also, however, is this sort of overarching sense by the people who work in corrections that the department often doesn't hear them in an operational way. That the anecdote, as it comes to me, I hear they ask me how I'm doing when they won't listen to me about how it's going here. And I'm pointing straight at the administration here. I'm pointing straight at Director Hughes and everybody below her. They have got to do a better job adhering to their own systems, teaching people how to interface with those systems. When something happens in a facility and it's reported by officers on the ground, those things need to be taken seriously and needed to be acted upon by the administration quickly. They cannot languish. They cannot sort of half answer questions. Because people start to get a sense that the facility itself, that the leadership at the facility themselves are putting people at risk. And that is just, it's unconscionable, it's unnecessary. And, if nothing else comes out of my participation in this particular session, we need the state of Illinois to hear that loud and clear. That these are not people that are crying wolf. They're not people who are just trying to bring you a bad day. They have legitimate issues that must be addressed, and we have to be serious about that. The other thing I want to mention in retention while we're talking about it is simply, and Betty, you mentioned mentorship. We have long worked with the state to build mentor programs around this work. We have a 6-week expanded orientation, we call it, that's driven by the union, so that the union can sort of help fill the gaps of the training and or the experiences that these women and men are having as they come in. We try to put them on assignments that are going to be fulfilling and clear, kind of in their early tenure with the facilities to give them an honest sort of start at the work and to help them sort of get a good foundation. And we're working with the state currently on expanding those mentorship programs.
Our last topic is well-being. Work conditions in the correctional areas are associated with staff performance, stress, and other factors such as exhaustion, dissatisfaction in the workplace. And the first question is, what are the most common psychological and physical health challenges faced by correctional officers, such as PTSD? Who can answer that?
Well, I'd like to kind of start off with that a little bit. And I know that Eddie and Kelly, they probably got a lot to add to it. But unfortunately, there's not a lot of data out on PTSD nationally on correctional officers. Also, there isn't a lot of data on suicide rates. It's always been kind of like nobody wants to talk about it. And we're starting to with a lot of where staff wellness over the years, particularly since COVID, and as we move forward, it's becoming better and to the light of the stresses and the occupational dangers of being a correctional officer or working in a correctional environment. So the psychological demands is being more realized. And so our correctional officers are at high risk for depression and PTSD. There was an article published in 2018 in California by Amy Lerman. She was at USC Berkeley, and she led a study on this. And you can go and our audience and can Google it, but it showed the dramatic increases of the psychological effect of working in the environment. And this is where it's very, very important that we get more research done in this area and address some of the issues. And some of the highlights of her study, was the high exposure to violence is very high. More than half correctional officers report that violent incidences are a regular occurrence in the prison that they work in. And almost 30% reported being seriously injured at work, and 85% reported seeing someone seriously injured or killed.
So I completely agree with everything that was just noted. By the way, I'm not trying to minimize it. There is an important sort of component of stay the course and bear that weight no matter what in corrections. And I hope I can help model some of that behavior just in responding here. But for all that, our folks face that daily, and many of them with a lot of good tools that don't sort of intrude and invade on their psyche and their lives. So there are also good lessons and good practices to be picked up in the work. But I want to point to the negative as well and say that even with the lack of data, the data that we do have is very troubling, right? There's a study, I think it was Berkeley several years ago, that talked about PTSD rates commensurate with active duty soldiers, like people in war zones. It's a similar aspect for folks that are in corrections. That seemed like exaggeration to me, I'll be honest. Seemed like a little bit of hyperbole. But as as I was engaging with our members around it, and the more I stayed in the work, I realized that there's a lot of truth to that statistic, that people really are affected by this work on a day in, day out way, and it manifests in places that they don't necessarily understand it's happening. And so I think, we've already talked about EAPs and personal support programs from the union side of things. I think that's a critical component, making sure that those resources aren't just available, but are held up as good examples of how to deal with this work, that there's no shame or stigma involved in seeking that kind of help. I think that's really critically important. Our union, and I'm going to brag about us for a little bit. We are extremely focused in this area. We are currently engaged in a program we're calling AFSCME Corrections Connections. And we are out there talking to our members about sort of this squishy area of need, and trying to, we don't really know what we're going to land on as a program after this effort, but we know we need to go and ask the questions. And, we've also done some awareness around suicide rates. Betty mentioned this. I just want to pick it up. It was 3 years ago, and thankfully we have seen it slow down, but we had 12 suicides in 12 months in corrections.
Oh my God.
Which, it's a department of 12,000 people. So it's a shocking statistic, but when you put it in statistics, it's a little less shocking, but it's still, it's unconscionable. We cannot allow that to happen if we can avoid it. If there are ways that we can, help mitigate it and provide services to those people in need, we have to do so. In one instance, just this year, we had one that happened in the parking lot of a facility. He showed up for work, and rather than go in, ended it. And that we have to address. There are always a lot of things going on when that happens, right? The job is one part of it. It's not all of it. And people, we shouldn't let that, thought be out there that it drove them to that. That's not the case, but it is sort of, it compounds upon compound. I think we mentioned it at the beginning of this webinar. It's a very stressful job.
Sophia, do we have any questions?
We do. We have one question so far from Ed. The question is there an optimum number of staff to inmate ratio? And how far are we in Illinois correctional facilities from being near that optimum number? Or put another way, how many officers need to be hired, and are staff salaries adequate?
A lot of it depends on the facility. A lower minimum facility is not going to need near as much staffing as a max. If you're going to have if you have more mental health issues, you're going to need more people inside there. And once again, location. We have 2 of our facilities who are near 100% staffed right now. We have other facilities that are in the 70s, and they're begging for people to come into there. So it depends on the facility. And once again, when somebody comes to one of our screening team will actually tell them, if you put down, right now we're telling, if you put down you want to go to Pontiac and you pass, you're gonna get a job offer, because Pontiac is very understaffed right now. I believe Menard is not my area, but I believe Menard is in that category too. it's going to be a little bit different manning there. So there's not really an optimal number per se, one way or the other. Just depends on where you are. But as far as hiring, we need hundreds. Every facility needs. If you can come in and work, we're going to try to find a job for you somewhere.
Also, I'd like to add the physical plant of a facility. You know, the older facilities sometimes need more staffing. The newer facilities, you got technology that has helped us a lot. But an older facility, chances are, and we have a lot of older facilities in our country. You know, and we don't have a budget or funding to build new ones. And so I think that has a lot to do with how in the numbers that we have to staff facilities also.
I'll try to give a global answer to this question because I think you guys have hit the kind of the facility-based stuff really well. The state of Illinois has 7,000 plus allocated but funded but not filled vacancies. So around 7,000 people who should be hired, who should be working for the state, who aren't. And in corrections, not to argue with Kelly, but it's thousands, not hundreds. You know, it's actually a couple thousand, between 2,000 and 3,000 people need to be hired in order just to hit that sort of, this is what we believe we need to hit these ratios, to hit the needs, to deal with the older facilities in some cases.
Yes, we do. So we also have one comment, just remarking on corrections as a legitimate first step into the criminal justice sphere as careers, something that Patty mentioned. And then we also,
and I'll tell you, we do that all the time because, like Betty said before, we have been there for a long time though, but we do take people at 18 years old. They still have to pass the screening. They have to pass the TABE test. They have to have we don't take anybody just a high school dropout. They have to have their diplomas and stuff like that. But we tell them this is a good way into. You cannot be a sheriff until you're 21 years old, and hopefully they come in and find out how good the job is, and when they turn 21, to say I'm going to stay here instead of going out there. I have a list of all the counties we have facilities in the state of Illinois. I made a couple months back, and I went through and found opening for correctional deputies, and we pay better than correctional deputy in every one of these counties except for Lake.
Right.
So we do have one final question, and this last question is from Jona. Is it easier to hire professional/clinical staff than correctional officers?
That's
No.
a loaded one.
No.
Thank you, Jona.
Yeah, the hard part that kills us, especially I'm hiring nurses. I am begging for nurses right now.
Nurses
And mental
are
health.
tough.
But I'm like Betty said before, I'm competing with a hospital who's paying just as much, if not more, and giving you a $20,000 or $30,000 signing bonus.
Amen. Amen.
And they don't realize how our job is actually easier than theirs. We don't have to deal with the emergency room situations, and so especially for our medical people. But getting them in and going through the whole state process, it takes, I will say, on average 4 to 6 months to get hired to a state job. By that time, somebody's already been picked up by Memorial Hospital or the local clinic. They've already, if they're a nurse or a mental health technician, they've been picked up within a couple of weeks, where the state is going to take 4 to 6 months to hire them.
Well, and that's interesting because when you look at correctional health services, you look at the different models out there, and where you see jurisdictions that are having a hard time hiring nurses and stuff, they end up going to privatized healthcare, and which is much easier, I think, to get and go through the system to get hired and up and going. And once this system is privatized and it goes out to bid, and just say that the provider changes, those people end up getting hired by the other provider. So it's tough, and it's tough to find our correctional nurses, our nurses to come to work in corrections. It's challenging, and so some of the things that we're doing and working on is have those flexible schedules for nurses, and also trying to, many jurisdictions are trying to give a sign-up bonus, also trying to compete with the local hospitals, the local clinics, and so on. Again, It varies from jurisdiction to jurisdiction.
In
We have
Illinois,
about 3 minutes before we end this, but I was going to ask each one of you like give a closing statement for about 1 minute.
Okay, want me to go first? I'll go first.
All right.
Needless to say, recruitment, hiring, and retention and wellness programs, particularly the recruitment, the hiring, and the retention piece of it. Correctional agencies are still facing critical staffing levels. They have been and currently continue to struggle in recruiting, hiring, and retaining appropriate staff. I think today we kind of outlined this in our short hour and just about an hour and a half. And this initiative, you know, we have to keep working at and getting and hiring and keeping our correctional staff. So just to cap some of the things that the takeaways of improvement in hiring practices, a well-designed curriculum can help correctional agencies develop more effective and efficient hiring practices, enhance training and support programs. A comprehensive, again, curriculum can provide HR and training staff with the knowledge, the skills, and the support they need to be successful mentors. We talked about mentors for new hires and career development opportunities. You know, to work on giving upward mobility, particularly when you our younger generation, that Zoomer. Improve the public perception, a comprehensive program that can help correctional agencies address the negative public perception of correctional work. We need to strive for better outcomes by improving the recruitment and the hiring and the retention.
Thank you.
Thank you very much, and I
Anyone else?
enjoyed it.
I just want to jump back to the last question about, you know, what can we do to hire professional clinical staff or staff in general? I think the state needs to show a real commitment to improving the tier 2 benefit and frankly, you know, doing away with it and going back to a fully funded and good retirement. Because the people that are contemplating these careers, the people that want to work in this system, that has historically been the reason that they're there, is that there's retirement security for them at the end of it, that it is something that they can build, you know, a career and a life around and toward. And until the state restores that benefit, I think we're going to continue with a lot of these struggles. We're competing in a very tight job market with a very limited number of resources, and we need to draw in a whole bunch of different professional titles in order to make that work. And it has to be attractive for, you know, in some way and for some reason. Illinois has always historically provided a good pension for that work until the tier 2 debacle. And they've got to abandon it. They've got to go back to real retirement security for these jobs. And I think we've got a good shot at, you know, continuing on into the future when that happens.